All right, I'm coming in, making sure the scene is safe. I don't see any obvious hazards, and I have my BSI on. I got gloves and a mask and eye protection. Hi, ma'am. How's it going?
Good, how are you?
My name's Chris. I'm with the emergency services. Can I help you?
Yes, please.
Yeah. Hey, just a quick question. Have you been exposed to anybody with COVID-19
No.
in the past 2 weeks? Have you experienced any shortness of breath, coughing, fever?
No.
And you haven't traveled out of state or anything like that?
No.
Have you gotten a vaccine yet?
Not yet.
Okay. Would you mind just wearing this mask for me for right now?
Sure.
All right. So, quick, again, I don't see any life threats here. My scene size up, no bleeding. She's obviously breathing and talking to me. How old are you, ma'am?
I'm 28.
28. And what's going on today?
I hurt my knee.
You hurt your knee? Anything else going on major that I need to know about?
No.
All right. So I have a 28-year-old female with a left knee injury. How did you hurt your knee? What happened?
I was hiking.
Oh, yeah, and you just came inside and then called 911?
Yeah.
All right. And did you hit your head at all when you fell or anything?
No.
Did you fall when you hurt it, or was it overuse, or
No, it just started hurting really bad the
just
last
started
couple
hurting?
miles.
All right, and your neck or back doesn't hurt anywhere?
No.
All right, cool. And then AVPU. So do you know who you are? What's your name?
Laura?
Laura. And do you know where you are right now?
Yes.
Where's that?
At home.
And do you know what day it is?
It's Tuesday.
And again, what happened between hiking and now? How'd you get here?
Well, I made it back to the car with the help of a friend. I sort of limped back, and I thought maybe it would get better, and then got home and it's swelling really bad and it's getting worse.
Okay, so she's alert and oriented ×4 to person, place, time, and event. I'm going to move on to my primary assessment. Could you do me a favor, just just pull your mask down and stick your tongue out for me. Nice, I don't see any blockages in the airway. She's obviously got a patent airway because she's talking to me. So it's open. If she had stuff in there, I would suction it, and if she was unconscious, I'd put in an OPA or an NPA. So breathing, I'm just going to check out your breathing. Do you have any trouble breathing right now?
No.
Do you feel like tightness in your chest or anything?
No.
No, and you don't feel dizzy, nauseous, lightheaded?
No.
All right, so I'm not going to consider oxygen. Real quick, I'm just going to throw this on your finger here. This is just a pulse ox. All right, so just give me a finger. I'll let that get a quick reading. And if it's less than 94% oxygen saturation, we're going to give you a little supplemental oxygen. And it's giving me a pulse of 80 and 98% oxygen saturation. Awesome. So OI pass, so oxygen. Can you do me a favor, take a nice deep breath? Nice, inspecting the chest, eye, P, palpate. I'm just going to feel your chest rate real quick. You tell me if anything hurts when I touch it, and I'm just going to feel, make sure you're taking nice deep breaths, okay?
Okay.
So don't mind my hands. All right, take a nice deep breath. Nice, and I feel nice, full and equal chest rise. I'm just going to listen to some breath sounds real quick. Take a deep breath. Take a deep breath. Nice. So I hear nice clear breath sounds bilaterally, and so that's good. And I don't see any, obviously, difficulty breathing, really worrying about sealing a sucking chest wound. All right, so moving on to my C, circulation. I'm going to just do a quick hands behind you and check for blood, all right?
Okay.
No blood. No blood. No blood. No blood. All right, and can I just feel your pulse real quick? And I know my pulse ox just said she had a pulse of 90, good saturation, and she's got nice, strong pulses bilaterally, and they're nice and regular, which is good. And then your skin feels nice and warm, nice and pink, kind of unremarkable, dry, so that's perfect. All right, D, I don't see any long-standing disabilities that can come from this injury. And my decision is I'm just going to sit here and kind of figure out a little bit more what's going on with her knee. All right. E, exposed. So do you mind if I just real quick just roll up? If I was in a lot of pain, I would cut her pants up. But can I just take a look at this real quick?
Yeah.
Does it hurt when you move it like that at all?
Yeah, a little bit.
All right, so we won't try not to move it. I'm just going to peek, and I see no bleeding, no major deformities. Awesome. So I'm going to start moving to my secondary assessment. So I'll start with a quick history. So obviously your knee hurts. I see a little bruising but no bleeding or anything. Any other pain that you're feeling or symptoms of nausea, uncomfort, pain?
No.
Okay. A, allergies. You allergic to anything?
No.
Okay. M, do you take any medications?
I don't.
P, past medical history. Do you have any medical history I need to know about?
No.
No. Any history of diabetes?
No.
Asthma?
No.
Chest pain, cardiac issues? Nothing?
Mm-mm.
Okay. L, what was the last thing you had to eat or drink today?
I had breakfast.
Breakfast? And that was before you went hiking or afterwards?
Before.
Okay. And then E, events leading up. So you were hiking this morning, and how long you been back for after your hike?
We called like 30 minutes after I got back.
Okay, so about 30 minutes or so. OPQRST, so when did this start hurting? Oh, onset. Was it during the hike, you said, right?
Yeah, the last 2 miles.
Last 2 miles, okay. So P, provocations. Does anything make the pain worse in your knee?
Yeah, if I try to bend it or straighten it.
Bend it or straighten it? Okay, so, but you like it bent like this?
Yeah, if I just don't move it, it's okay.
Okay, Q, quality. Can you tell me the quality? Describe the pain. Is it sharp pain? Is it a dull pain?
Yeah, it's a really sharp pain with movement.
Sharp pain with movement, okay. R, radiation. Does the pain radiate anywhere? Does it move up or down?
Not really, no.
Okay. Scale, S, severity. Scale of 1 to 10. 10 being the worst pain in your life. What number is it?
Like a 6?
A 6. What about when you move it?
Yeah, I would say 6 when I move it.
Okay, and then right now it's a what?
Like a 3 or 4.
3 or 4. And then T, time. You said it's been about how long since it actually started hurting on your hike? I know you called us after a half hour you got home, but...
Probably like an hour and a half.
Okay, nice. So that's a good sample of OPQRST. I'm going to do a quick head to toe. So you look just straight ahead, and you tell me if anything hurts, okay? So I'm going to start up here. And I know you said you didn't hit your head or neck or anything, but we're going to just double check now. Any of this hurt? Feel the back of the head to the neck. Anything on the front here? Down here? All right, I'm going to just take a quick pen light. And I'm going to play your mask down again. Open up. Nice, nothing. All right. How about down here? I know I assessed the chest, but I'll do it one more time. Any of that? Any of this? On the side? All right. I'm going to keep walking my hands down your back here. Any of this hurt?
No.
All the way down to the bottom of the spine. Nice. I'm going to just feel your belly here, okay? You tell me if anything hurts. Any of that?
No.
All right. I'm going to just kind of squeeze your hips here. Does that hurt when I push in?
No.
All right. I'm going to go down and feel each leg. Any of this hurt?
No.
No? And can you wiggle your toes for me? And you feel me? What toe am I touching?
My big toe?
All right. I'm going to skip this part of the knee. I'll come back to that last. Any of this hurt?
That's a little tender on the side.
On the side? Okay. What about down here?
No, that's fine.
You wiggle your toes? Feel that?
Yeah.
Nice. All right. Feel your arms. Any of that hurt?
No.
Squeeze my finger. Do you feel wiggle your fingers? What finger am I touching?
Pointer finger?
Same on this side. Wiggle your fingers. What finger am I touching?
Middle finger.
You look. All right, and then feel it again. Bilaterally, both nice. All right. And now, so if I touch right here, does that hurt?
It's a little sore.
Yeah, what about on the side?
Yeah.
Okay, so that's where it hurts. Awesome. And that makes sense. That's where it's bruised up. So I did my sample of QRST. I did my physical exam. I didn't find any other injuries except for the knee. Now we're going to do a quick set of vitals. So let me just feel your pulse here. My pulse ox before said 80 beats per minute, 98%. But I'm going to do a quick count. All right, I got about 80 beats per minute and 14 breaths per minute for respirations and for pulse. Again, I'm just going to throw this pulse ox on again. Any finger's fine. All right, while that reads here, I was going to ask you to look straight ahead for me. Straight ahead. I'm going to just check your pupils. Look straight ahead. Nice. Positive pearl. Pupils are both equal and round, and they react to light. SpO2 concentration of 97%. Pulse still at about 78. 80 beats per minute. Awesome. I'm just going to get a quick blood pressure on you. Is that okay? Any way you think I could squeeze you an arm out of here so I can listen? If you can do that without pain, that'd be awesome. Okay. Oh, you went to Holy Cross? Me too. It's so funny. All right. Just relax your arm, hold it straight. Perfect. Could you hold that for me? Thanks. I got 118/72. Is that where your blood pressure usually is? Okay, awesome. And so for vitals, I did pulse, respirations, blood pressures, pupils. I checked her skin already, and I got oxygen saturation. The last thing I would take, and I don't have it with me, is a thermometer. I'll take her temperature and see her temperature. So I did a full set of vitals. I did my physical exam. I did my sample history. We're going to treat this knee, and we'll get this splinted up, which we'll do later on. And we're going to do our ongoing assessment. So she's a pretty stable patient. I'm going to reassess her vitals every 15 minutes. And you definitely would like to go to the hospital and get this checked out. All right, awesome. And we'll do our ongoing assessment, starting over, doing our ABCs from the beginning, reassessing vitals, and monitor on the way to the hospital. The end.